Good morning. We just heard the news this last weekend that there were 6 fatal overdoses in Chesterfield County, one of the 3 counties around Richmond. It's just tragic, and we know it's fentanyl. Almost certainly there was a batch of what was being sold as heroin, I guess, on the streets. I don't even know what people buy it as anymore. Most people know it's pretty much pure fentanyl. But that would have hit the streets, and it would have been a little more powerful than people were used to using. And fentanyl is so fatal, it's so powerful that any little dosage adjustment is the difference between people getting high and people overdosing and dying. When we look at statistics for the last few years, the number of people using heroin and using opioids has actually started going down somewhat quite dramatically, but the number of deaths unfortunately has been going up, and it's all because of fentanyl. Fentanyl, of course, is the synthetic opioid that's much stronger, 50 times stronger than heroin, and so the dose needed to be fatal is just really small, and it's measured in micrograms, so the way that it's sold, it's just a potential dangerous thing that's almost impossible to calculate the right dose. And that's the reality we're living with. Fentanyl is super cheap to make, it's easy to make, it's easy to smuggle, and there's huge amounts of money to be made by the dealers and the people making it and bringing it into the country. So unfortunately it's not going to be going away. What we need to do is decrease the demand. If you have friends or family, you need to get them into who are using opioids. They need to get into treatment as soon as possible. They need to get into some form of medication-assisted treatment, either methadone, Suboxone, or naltrexone, or maybe go into a long-term treatment program where their brain can have time to heal. But it's imperative. It's just too dangerous. We've fortunately been seeing a number of people coming into treatment because they know how dangerous it is out there, but we need to get the message out. So we need to just, let me say it again, get people into treatment. If you know anybody who's using drugs, or if you're using drugs still, please get onto some form of MAT. If you're working in the public sector or in any system that has the ability, the ideal system would be that we would have health departments or publicly funded medication-assisted treatment that would be open and available 24/7. That anytime somebody has the thought, I need to stop this madness, it's just too dangerous, I'm not having fun anymore, then they can get into treatment as soon as just going to their local emergency room or going to some facility and getting on Suboxone probably at that point, and then transitioning on to the best medication-assisted treatment for them. So let's try to get the word out and try to stop this second epidemic that's going on, and actually it's been going on, obviously, this epidemic, the opioid epidemic, for a lot longer than COVID. But we need to put a stop to it, and we need to all work together. Thank you.